Hello and welcome to the ASPS International Residents Forum podcast. I'm your host today, Jing, Chair of the ASPS RF. I'm joined today by my colleague from Italy, Dr. Giulio Tarantino.
Hi everyone, it's Dr. Giulio Tarantino over here. I'm a fourth year resident in plastic surgery in Rome. Happy to be a part of this team and this podcast. And on today's episode, we're going to be talking about surgical mentorship. Dr. Jing, how about you talk a little bit more about this?
Yeah, it's a very interesting topics for all the residents, I'm sure. For example, I'm currently doing a nerve fellowship in Taipei with Professor Chuang. We found that mentor do really kind of influence a resident's career choice. Sometimes the time constraints, geographical barriers, and lack of formal programs can continue to challenge effective mentorships, particularly to our international community. We are very incredibly fortunate to be joined by Dr. Janis today, who himself needs no further introduction if you're a plastic surgery doctor. He's the professor and chief of plastic surgery at the Ohio State University Wexner Medical Center, past president of the American Society of Plastic Surgeons, and the editor-in-chief of PRS Global Opened. He's also responsible for a number of textbooks, including The Essentials of Plastic Surgery, Essentials of Aesthetic Surgery, Advances in Abdominal Wall Reconstruction, and more. Now there's quite a handful. Let's look at the man behind all these titles. It's always easiest to start from the beginning. Dr. Janis, can you tell us why or who got you into plastic surgery?
So first of all, thank you for inviting me. It's an honor to be with you today, and I promise to tell you the complete unvarnished truth. Although it may not be interesting, it certainly is not sexy, that's for sure. I actually tripped into plastic surgery. I envy those who knew that they wanted to be a plastic surgeon right out of the womb. That was not me. I actually traveled through life mostly not knowing what I wanted to do. And when I was in high school, which was a while ago, they gave us what was called a Scantron test, which was kind of a multiple choice test. And the conclusion of that test was supposed to tell you what you were going to be when you grew up. Mine told me that I was supposed to go into business. So I actually applied to nothing but business schools and ended up matriculating into business school. After the first couple of years of taking requirements, I thought it was interesting. It just wasn't as compelling as I wanted it to be. So I sought consult with my marketing professor, who said, stay with it and also branch out because you get the opportunity after finishing your requirements to do some electives. And so with one of those electives, I actually branched out and took a biology 101 class with about 700 people in it. This was at Washington University in St. Louis. And at the end of the class, believe it or not, they posted your grades on the window of the front door of the class. To hide your name, they posted it with your full social security number, which is laughable to think back on it now. And surprisingly, I scored number one in the class. And the reason why I say that is because that's what caught the attention of the professor. And that professor actually reached out to me and called me into his office to find out who I was, because I was not pre-med. I didn't do any sort of medicine or biology. This was my first taste of that kind of stuff. I was in the business school. And so after learning my background and history, he suggested that I maybe consider biology, science, or medicine. His name was Professor Johns Hopkins, by the way. He was the great-grandson of the namesake of the university. And sometimes you just never know when you cross paths with somebody about what kind of impact or influence they may have on your career or even your life. His 15 minutes with me, which was unsolicited, definitely changed my trajectory. Now I don't ever start something I don't finish. So I finished my business degree, but then did all 4 years of pre-med in a summer and a year. So that's how I got into medicine. and applied to and got into medical school. Fortunate enough to do that after compressing all of that training into a small period of time, and passed my MCATs strongly enough to get into medical school. And it was during medical school that I went to every rotation with an open mind. My first rotation was rural family medicine or family practice. And at the end of that month, I thought I was going into rural family practice. Then came internal medicine, and at the end of that, I thought I was going into medicine. Then came surgery, and I actually walked into that rotation thinking, there's no way I'm going to be a surgeon. They're all a bunch of assholes, and I don't really want to be around that type of person, especially coming from business school, which was incredibly competitive. But I must say, at the end of my surgery rotation, I was hooked. There's a feeling that you get at the scrub sink that I really can't describe. But I know that if I ever lose that feeling, that I'm done with surgery. I haven't lost it yet, but I just knew that there was something in my future that was related to surgery. And it wasn't until I would say maybe the third year of medical school that for no reason at all, walking down a hallway on a Saturday night by myself, wearing my short little white jacket, with nobody in front of me, nobody behind me. For no reason, I stopped just in front of a water fountain, uh, just dead in my tracks, looked up and down, left and right, and said to myself in a bare whisper, plastics. And that's pretty much how I made the decision to go into plastic surgery. I had seen a few plastic surgeries, but I just don't know. It was almost like a lightning bolt struck. I don't necessarily believe in destiny, but I just felt like that really captured my heart, and I felt strongly about it. And I think the litmus test of a good decision is how you feel after you've made it. And I felt really comfortable and really good about that. And the rest of it was spent doing rotations, both home and away, and throwing myself into plastic surgery. And that's how I got into plastic surgery. And so I know that's probably a curveball and probably unlike many other people's paths and trajectories. But I think the point of it is that it doesn't take much sometimes for people to have a strong influence and impact on your life. And you should do what you love and love what you do. And I've boiled life down into two things. And you could call them elements, right? If a compound is a combination of elements, but you get down to the elemental level and you can't subdivide it anymore, then the two elemental things that I live my life by is wanting to get out of bed in the morning and sleeping well at night. And I figure if I have both of those, then everything in between should be just fine. And so that's where I'm at today. I love to get out of bed every morning, and I definitely sleep well at night for the few hours that I actually do sleep.
Wow, that's really incredible. It's also very inspiring. I'm going to go out here on a limb and say, um, as an international resident, we don't always have equal opportunities in mentorships, starting even from the beginning of residency all the way to the end as a newly, plastic surgeon was just recently completed their training. I'm actually very curious along this route of your life thus far as a resident and as a young doctor, who were the most important, maybe the first one or two mentors in your life? What key characteristics that they had that you brought along as a future mentor yourself?
Well, there's a few along the way, so I'll just kind of mention them in chronological order. I would have to say that Marcy Armstrong, who went on to be the dean of the School of Business at Southern Methodist University, but was my old marketing professor at WashU. I already told you her story. If it wasn't for her encouragement, I definitely wouldn't be where I was today. I actually went back years later. This was after I even was junior faculty at UT Southwestern. I went back, found out how to get a hold of her, and sent her an email and basically just said, I'm sure you don't remember me, but I just wanted to say thank you, and here's why. And I told her the story, and she responded to me, and she was a dean by that time. She certainly probably didn't have any extra time in her schedule to answer a no name like me, but she did. And she said, of course I remember you. And she said, you're welcome. And we went on to have a good conversation. So I do think another important point is go back and say thank you. It certainly doesn't cost anything but a few minutes of your time. And I do think that the recipient definitely appreciates it. The next person after Johns Hopkins, who I already mentioned, I would probably say was my chair of surgery in medical school, doing rotations, which was Jeff Ponsky. Jeff Ponsky was the chief of surgery at Mount Sinai, which was a community hospital affiliated with Case Western Reserve, which is where I went to medical school. And he really was a huge impact on me. And he invented the PEG tube, if you guys know what that is. He's an innovator, a surgeon scientist, and a wonderful mentor. And he cultivated my interest in surgery. And I even years later went back and said thank you to him as well. But he definitely was a huge influence and positive impact on me. The next person I would say would be Dr. Ed Luce, who was the chair of plastic surgery at Case Western when I was a medical student. I still maintain a friendship and correspondence with him. He and I were going back and forth by email as recently as a few days ago. But again, for a chair, somebody at that level, to invite me to his office when I was a third-year med student and have lunch with him and talk plastic surgery one-on-one, again, creating the time and space for mentorship to take place is not an easy thing to do with as busy as people are these days. And I don't think anybody's, less busy now than they used to be, by the way. Dr. Luce was incredibly busy, both clinically and administratively, being a chair. But again, he was a huge, lasting, enduring impact on me and my career. And that led to Dr. Gary Perdue, who was a burn surgeon at UT Southwestern, that I did a burn rotation with when I was a visiting med student. Believe it or not, I never did a visiting rotation, not even one day in plastic surgery at UT Southwestern until I matched in plastic surgery. I did burns. I didn't do plastic surgery. But Dr. Perdue was very close friends with the chair of plastic surgery at UT Southwestern, who was Dr. Rod Rourke at the time. And Dr. Perdue put the good word into Dr. Rourke's ear. And I was lucky enough to be invited for an interview at UT Southwestern, and ended up matriculating to my residency there. Dr. Rourke was another huge role model and impact on me, as were the other faculty that I was with at UT Southwestern. But I got into academics all because of an accident. Because when I was a fourth-year resident, about to rotate onto his university hospital service, it was a Friday afternoon, and we had cubbies. We didn't have really email at that time. And he put a Post-it note in my cubby, and he said, write me a CME on male rhinoplasty. So I spent the whole weekend in the library with my copy card, Xeroxing all of these articles, and writing a draft of a CME article on male rhinoplasty, printing it out on my dot matrix printer. And on Monday morning at 7 in the morning in the OR lounge, right before going back with one of his cases, I handed him the draft of that manuscript. And he hesitated for just a moment and then said thank you. And it was in that moment that I realized my mistake. My mistake was that he didn't tell me when it was due. He just told me to do it. And so, of course, the reward for good work is often more work. So, what do you think he did? He assigned me 3 more articles. Write me otoplasty, transcutaneous approaches to orbitozygomatic fractures, and xanthelasma. And a week later, I had 3 more papers in his hands on his desk. And this went back and forth, this game of surgical chicken, basically, for the next 8 weeks, which was the duration of the rotation. And I wasn't going to give, and he wasn't going to relent. And so after the end of that rotation, we had 9 papers that we did together. Now, mind you, the only research I had ever done before that was a poster presentation that I did after my first year in medical school on respiratory rate, where I worked in an emergency department for a summer and followed a triage nurse around. And after she roomed a patient and wrote down 18 for every single patient she ever saw, I followed up 3 minutes later and measured and documented the real respiratory rate, which had a range of 7 to 63. And the title of my poster was, "Is respiratory rate really a vital sign? Because if we never really measure it, then why is it so important?" That had nothing to do with plastic surgery. And that was the only research I had ever done. Which, by the way, compared to the type of applicant that tries to get into plastic surgery these days, which basically is associate professor by the time you apply, I never would have been able to get into plastic surgery these days. But that was my only research that I had ever done. But at the end of that 2-month rotation, having generated 9 papers and going back and forth with Dr. Orrick, he actually offered me a job. And this was in December of my PGY4 year as an integrated resident. And at the time, by the way, it was a 5-year program, not a 6-year program. And I had never considered going into academics. Matter of fact, I was going to go into private practice. And so he said, "I need 3 years to make you profitable." And I said, "I'll give you 1. So he made me an assistant instructor, which is not even an assistant professor. I made $85,000 that year, but that was a whole lot better than the $51,000 that I had made it as a chief resident, pre-tax, of course. And I thought I was rolling in the dough. I was like, what am I going to do with all this money? This is crazy. So basically, that's how I got into academics. And I signed a series of 9 one-year contracts every year, telling Dr. Rourke I was going to leave and go into private practice in Ohio. And every year he found a reason and compelled me to stay. And that was the beginning of my career. And so I certainly have had other mentors along the way after Dr. Rourke, including Dr. Bauman Guyron, who had a heavy influence on me, especially with migraine surgery, Dr. Chris Attinger from Georgetown, who is a master of limb salvage and just a damn good doctor, and others that have come after that, and plenty of people that I look up to. Dr. Fritz Barton, who taught me that there are 2 types of patient, perfect and other. And if you're not perfect, you're other, and really had super high standards, but was an incredibly thoughtful and incredibly skilled surgeon. Taught me a whole lot about plastic surgery, as did Dr. Steve Bird. I could go on, but those are some of the names that come to mind in chronological order that kind of tie a lot of these points together on the curve.
That's just incredible. Obviously, we have met some great mentors along the way, but we have to take into account that it takes 2 to tango. What do you think from your side now, from a mentor perspective? What do they look for in a trainee? In other words, what do you think a trainee can bring to the table to get these mentorship opportunities?
Mentorship to me is not an arrangement. It is not something that is incredibly structured and scheduled or even assigned. I know that there are different models out there, and I've certainly looked into them, and we've even published on mentorship many times. But mentorship, first of all, just requires 2 people to dedicate the time, and time is everyone's most valuable asset. And so I think what it takes on both sides is a willingness to create the time and space for mentorship to take place. If you're too busy to have a conversation, whether that's on the phone, virtually by Zoom, or in person, or even go out and get a cup of coffee or sit in your office, wherever, mentorship won't take place. So I also think that mentorship does not know geographic bounds. I feel like I have mentees, and for that matter, I have mentors that live in other parts of the country and the world. And I'm grateful for that. They spend the time with me, and I pay it forward to spend time with others. And so I think that that's first and foremost what it takes. It takes time. It also takes some sort of common ground. You need to listen to what people are asking, provide your best unvarnished, transparent, honest truthful response. Not what people want to hear, but what people need to hear. And I think there's a difference, by the way, between the two. And you'll find your intersection points. That said, I don't think that there's a mentor that meets every mentee and covers 100% of the spectrum of what they're interested in. You can have different mentors for different reasons, and you certainly can have more than one at a time, and they don't all have to be sequential. I mean, I know I have many mentors that I can depend on right now, that fill different needs, so to speak. And I think that is true with my mentees. My mentees, I think, come to me with certain questions or problems or issues or queries, and I help them as best as I can. But I'm positive that there's other people out there that can also hit other nails, so to speak. So I think all of that's important. You got to have time, and you got to have honesty, and I think it starts with that.
Wow, that's also really incredible. Everything that you've said so far is continues to be inspiring for myself and all residents alike. I wanted to ask specifically something about how something that came to be in your life, in your practice, and how we could also even say that you're kind of a mentor for all plastic surgeons or plastic surgeon residents alike around the world, because anyone who's read and consulted Essentials of Plastic Surgery has really benefited from all the versions of that textbook. So I'm specifically wondering now is, how did Essentials of Plastic Surgery come to be? What was your thoughts behind that? Like, what truly inspired that?
Well, I'll give you the honesty that you deserve. It was an accident, and it
Really?
wasn't even my idea. Okay, so I mean, again, you ask the questions. I don't even know what you're going to ask, but I'll give you the honest response.
That's exactly what we're looking for.
So in residency, we were required to keep a notebook, which was, in my case, a 3-ring binder, and mine was not small. Okay. Like, I took notes during every conference, during every lecture, during every grand rounds. To prepare for cases, I would read all of my resources. I would, at the time, we didn't have the PDFs and it wasn't electronic. I would literally use my copy card, make a Xerox copy, even of anatomy, shrink it down, cut it out with a scissors or a paper cutter, and then glue it in or tape it into my notebook. And I would carry around this notebook, and all of us did at the time. Matter of fact, Rorik used to spot check us sometimes and say, "Let me see your notebook." So you always had to have it on the ready. Well, I was sitting in the kitchen of one of my friends named Jose Rios. He was a year ahead of me in general surgery, but then after he graduated from general surgery, he became a year behind me in plastic surgery. And we were great friends. And I was sitting around his table actually having a beer, and he was like, there really is no handbook of plastic surgery. At the time, there were these tomes, these multi-volume sets, McCarthy, Mathis, what have you, that these were like multi-volume hardcover, sit on a bookshelf. There was nothing small, nothing portable. And the closest thing to it was probably our plastic surgery, notebooks that we were personally keeping. So he was like, I wonder if we should, try to fill that gap, make a little handbook. Of course, his idea was probably something more in line of a pamphlet. My idea was something a little bit more extensive. And so we went to the publisher, Karen Berger from QMP. We pitched the idea, and she took a chance on us. We signed a contract to write the book. And pretty much right after that, Jose, who was graduating now by that time, decided to go into private practice with his wife, who's a dermatologist, does Mohs surgery. And he didn't really want to do the book anymore. He had bigger fish to fry and was starting his life and starting his practice. He had young kids. And he basically said, Jeff, this is yours. And I was like, Jose, it's not mine. This is yours. It was your idea. It was your kitchen table. As a matter of fact, it was your beer. And I thought we were doing this together. I never would have signed a contract if I was doing this alone. And he's like, all right, well, it's yours. I'm out. So I ended up picking up the project, and I asked my resident friends. And again, when I graduated, I stayed on at Southwestern. So I was junior faculty, but of course I was friends with all the residents because I was just one of them. And I asked them if they would help write the book. And so they wrote a lot of the chapters, and I put a lot of time into it. I basically rewrote every one of those chapters, sometimes 8 or 9 times until I got it to a point where I liked it. And I think in bullet points, I think in sound bites. So when you look at the style of that Essentials book or that Essentials series, that is a little mirror into the soul of how I think. I think that way. Like when I read a paper, I feel like I should be able to explain the point of that paper on an elevator between the first floor and the 5th floor when I get off. And so that's how I store things in my head. And so that's where the style was created. That's where the book came from. And the first one I started writing in 2003. And I think it didn't come out until no, it was 2002 maybe, and I think it didn't come out till 2007. So it took me 5 years to get the first edition out. The second edition, I actually started working on the Essentials of Aesthetic Surgery, but then Karen Berger said, I want you to start working on the second edition already. So that took me from 2008 to 2014 when that second edition was released. Then I picked Aesthetic Essentials back up and worked on that from 2015 to 2018. So that was released in 2018 after revising it like probably 3 or 4 times. And then I worked on the third edition of Essentials from probably 2018 to 2022. That's when, or 23, and that's when the third edition came out. So all of that to say, all of this was by accident. It wasn't my idea. But ultimately, it's a labor of love, and I'm grateful that you find it impactful. I think that's the best thing I could ever hear is that it helps other people. But that's the real story, in case you didn't know it.
Well, if the essentials of plastic surgery is an accident, we can only hope that the mistake happen more often from yourself. We're a big fan of your work. Now that you have been a visiting professor at multiple institutions internationally, how do you view mentorship cultures? How does it differ across different countries?
I don't know that I see that it largely does differ across other countries. I right now am working with about 37 people. I keep track of projects that I work on using like a little Google sheet. So it's definitely nothing fancy. But right now I'm looking at it while I'm talking to you. I've got 102 ongoing projects, 89 ideas that I have not had the time to deploy or execute, and working with, it looks like nearly 40 people from around the world on different projects. Um, and so I think that different people have different interests. Certainly, all of these projects are on different things. In my mind, I think, yes, we work on research together, and that gives us a common intersection point. But I would say that's a springboard, because a lot of times when I interact with these folks, we talk about research, sure, and we get progress done, sure. But people then jump off into their own personal questions that they have, and it is a little bit different individual to individual, but largely it's the same. Career advice, answers to questions, especially because a lot of people feel like they don't get the 100% truth, on things. Sometimes, they just want some straight talk. Somebody who they know and trust is going to give it to them straight, and I feel like that's my obligation. And so, that's kind of where I stand on mentorship. I don't know that it's hugely different across states and even countries.
Thinking about all your achievements so far, obviously you have been nominated multiple times as Teachers of the Years. What makes you most proud as a mentor in your past experience? Is there any special names or occasion that you remember as a mentor?
Uh, that's a great question. First of all, I should tell you, I never tried to do any of that stuff. So, like, even when you talk about Teacher of the Year, or even if you went further and said, like you mentioned earlier, that I was president of ASPS or president of this, that, and the other, I'll just have you know that my aim, my goal, it was never that. I started just by raising my hand, volunteering my time, being a member of a task force or a subcommittee or a committee, being part of the conversation, meeting people, becoming friends and colleagues with folks, all working, for common reasons and swimming in common directions. And eventually, you just kind of work your way up and through organizations, and get to leadership levels. And mentorship is a type of leadership. And I'll even go back to how I started when I mentioned that I think it's important to go back and say thank you to your mentors. I would say probably some of the proudest things that come to my mind are when the people that I work with and interact with just say thank you. I think that's great. But I'm most proud of when I see them go on and do great things that they want to do, and achieve things that are even more than what they expected. I do think that people can jump higher than they think they can. They just need encouragement and support. I actually don't even think you can motivate people. I do think you can demotivate people. But I think motivation comes from within. I used to have this discussion with Dr. Rorik when I was the program director. I eventually became the program director at UT Southwestern. And he believed that you could take a lump of coal, put it in a black box, and get a diamond. I believe that you find a diamond in the rough and you put them in a black box and they become a diamond. Now, the first example is very black box centric. The second, though, is very dependent on the diamond in the rough. And in my opinion, there are certain things that you can't teach. At least for me, and I'll speak for myself, have never found a way to teach things like passion, enthusiasm, energy, grit, drive, verve, gumption. These are things that I think probably harken back to your mom and dad, or maybe some of the earliest influences, teachers, during formative stages of your personality. But in my opinion, those are things that you come to the table with. And then you put them in an environment where they can be, supported and thrive. It's like a sandbox, a playground. That's my philosophy, actually, for all of this. You have some diamonds in the rough that have things that I can't teach, that come at you with passion and enthusiasm and energy. And you're there to just kind of harness that, support that. And then you watch them go out and do phenomenal things. And that answers the question for me, because when I see them accomplish their goals, that's good enough for me.
Wow, really, honestly, continuing to provide inspiring words for all of us. It's incredible how such personal stories can lead so far down along the road. Um,
Well, let me make a comment on mentoring international folks in particular. I first of all, I think that these days, if you want to make lemonade out of lemons, one thing that the pandemic showed us was that you can still have meaningful communication even if you're not in person. And although I'm glad that those times are in the past, there are lessons learned. Zoom wasn't a word, and at least not for me back in 2018-19. After 2020, I think it was a household word. But it just goes to show that we can connect virtually, still face to face, but virtual. And the only thing that it really requires is accommodation of time zones. But I would say on a weekly basis, I certainly am having mentor mentee interactions on a daily basis. On the international level, I would say every week. I'm talking to people across different time zones outside of the U.S. I'm going to guess somewhere between 3 and 5 times a week. And so I would say that the hardest part is just coordinating the time, but that is definitely possible. And I do think that all it takes is an email. That's how it usually happens with me. Introducing yourself and saying, hey, listen, I've got this interest, or I've got this question. Here's a little bit about me. Do you have a little bit of time that maybe we can connect? And I'm happy to try to spend the time and answer those questions. And most of the time that can go on even further than just a single interaction. It's just got to start somewhere. But that's as easy as it is for me anyway. I can't speak for how it works with other people, but I get emails like that all the time.
you took the words right out of my mouth. I don't know how you did it. Thank you for understanding what I was trying to ask earlier. You mentioned actually the specific thing I wanted to discuss, the virtual mentorship, which isn't something that a lot of people agree with. Some are on board, some are a little less. Branching off from that, what are future perspectives that you see for future mentorship, or as you were saying, even contacts and relations with national and international colleagues? What do you see as further steps, especially now in the world of AI?
Yeah, I think I don't know that AI has much to do with the mentorship part of it, at least in the way that I see it. I know that, like, when I have interacted with international folks before, which is, I would say, easiest virtually. I like to see who I'm talking to. I don't mind talking to people on the phone. And for that purpose, when I do speak with my international folks by phone, it's usually by WhatsApp, just so it doesn't cost anything to anybody. And we set a time and a schedule, and we stick to it, if that's the preferred way of communicating. But usually it's, let's say, Zoom or Teams or something like that. But the cool part is that can springboard into some in-person opportunities. And so, for instance, for ASPS, we have PSTM, or plastic surgery, the meeting, and that takes place every year, usually October, sometimes September. And that even though it's a domestic meeting, and that it's held in the U.S., with some exceptions occasionally for Canada. I would call that an international meeting. If you guys didn't know, 30% of the ASPS membership is international. So it's truly an international society, despite the A standing for American. And I look forward to seeing folks that I've met along the way who can make it to that meeting. And we try to set aside some time where I can connect with them in person. As long as there's enough advance notice, we can do that. There's also plenty of receptions involved, so as you mentioned earlier, I'm the editor-in-chief for PRS Global Open, which is obviously a global journal. And we have a lot of contributors to that, not just authors, of course, but reviewers, and the reviewers can come from every corner of the world. And so we try to host occasions at PSTM where we can get everybody together at the same time and interact with each other. So a natural meeting point is at PSTM. This year it's in New Orleans in October. Look forward to seeing people there. And next year, if I remember correctly, it's in Houston. But it's not just at meetings like that. I do go to other meetings outside the country. And I have met plenty of other people at some of these other meetings, more in their backyard than mine. So if we do find out that I'm going to be near them, around them, or actually that we're going to be going to the same meeting, or let's say I'm speaking and they're going to be there, then we'll find time for some coffee or a chat. And so again, like, to me, it's as easy as that. My answer is always yes, if we can carve out the time. And so that's hopefully answering your question about how to connect and stay connected to international folks.
Yeah, absolutely. Are you going to be attending any upcoming international meetings?
So I'll be in Canada in September, and then I'll be at PSTM in New Orleans in October. I've got a meeting in November, but that's not an international meeting. That's a board meeting. And then I think my next one will be over in Europe in January or February. So yeah, I mean, there's plenty of meetings coming up. I usually go to one of my clinical focuses is abdominal wall reconstruction. So, the meeting in Europe will be the AWR, or Abdominal Wall Reconstruction Europe meeting. That'll be in January or February.
It's been a real pleasure chatting with you, Dr. Janis. So refreshing to listen all to your honest answers to all the questions we asked today. I just love your attitude to life and all your analogy and metaphors that you have given us today. I'll remember it very vividly. I'm sure it has been inspiring to all our listeners today, and thank you so much for taking your time.
Well, you're very welcome, and I again am honored by the invitation to spend a few minutes with you today. I hope the listeners have got a little something out of it, most especially that you don't have to have firm plans and a dedicated structure for a lot of the things that we talked about. Just requires a lot of the things that we said. You got to have energy, time, interest, passion, enthusiasm, commitment, and for me, I just feel like I have a great debt that I carry from other people who have invested in me, and I want to pay it forward as much as I can to others and also to the specialty, because I love plastic surgery. And like I say, I love to get up every morning and sleep well at night. And so for me, that's what I love. And so hopefully other people who love plastic surgery as much as I do, we have a lot of common ground together, and they will pay it forward too. And the cycle goes on and on.
Well, thank you so much, Dr. Janis. It's been really, really a pleasure. And I learned a lot. I'm sure all the listeners have as well.
Thank you.
So to all the listeners out there, thanks for joining in with this episode of International Residents Forum podcast. We certainly hope that you have enjoyed listening to Dr. Janis today, and be sure to catch our next episode where we'll be discussing clinical research in plastic surgery residency. Till then, stay tuned. Thank you.